Sciatic Relief. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. Hi, I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Let's talk about the pain that you get in your butt and your lower back and sometimes shoots down into your leg and all the way down into your foot, otherwise known as sciatica. If you've experienced that and you're here looking for some relief, I want to help you with a quick technique that you can do at home. First, let's talk a little bit about why I'm going to show you this technique. One thing I want to talk about is the dura, or the dural tissue. It's part of the nervous system, and why this technique that I'm going to show you later, it can be very helpful, not only for sciatica, but even neck pain and headaches and general back pain. So when we talk about the dura, think of it like a really thick sheath or covering of the nervous tissue. So that means your brain is covered with this, as well as the spinal cord as it comes down off of the brain. So here on my model, you can see it. It's represented by the yellow. So deep in there, you can see the spinal cord, and then we have nerves that come off of the side. Okay, so when we're talking specifically about the sciatic nerve, we are actually talking about the levels that come down, I will say, down into the lower back. So all of these vertebrae are numbered. So basically, it's just the lower part of your low back, L4, L5, and then the sacrum, this triangular piece, S1 and S2. So you have a sciatic nerve on your right side as well as one that comes off onto the left side. So you do have two of them. So you may be experiencing sciatica more into your back. It may come down and travel up into your buttock. It may go down the back of your leg to the knee. And then from there, it can split to the front and the back of your lower leg. So you may experience sciatica along that distribution of that whole nerve. When it comes to sciatic relief, I want to encourage you to look beyond just where you're feeling the pain, because the dural tube and the dural tissue actually extends beyond just that spinal column. It goes down into the nerves, again, into your legs and your back. Sciatic nerve is just one of your nerves, but we have nerves that go down into the pelvic area. We have nerves that come down from the levels of our neck down into our arms and our hands and around our trunk. So I'm going to encourage you to consider yourself being a whole person, that if we only focus on where you're feeling the pain, we may miss other areas that your body needs a little attention in order to relieve the pain completely. So for example, if you have a lot of tightness in your shoulders and upper back, which a lot of us do because we have computer work that we do, we're on our phones, we work with our arms, right, and our hands. And so having tightness in the shoulders is not uncommon. So if you have this tightness that's kind of pulling you forward, or tightness into the front of your hips, I often see that as a physical therapist as well. So we kind of have this pulling forward. And so what happens is, if we kind of give into that, we would be walking around looking at the floor like this, right? So what happens with that tightness, our body adjusts, and we want to make sure that our head is pointing straight ahead. And so we start to get a lot of extension or tilting into that upper neck and back. And that can create a lot of strain and tightness up in there, which is pulling from the top part. So if we think of the dural tube or the dural tissue as kind of an elastic band, if we have tightness here, it's going to be causing some strain that can work its way on down into that lower back and into the sciatic nerves. So what I'm going to show you with this dural tube release is really, it's kind of what I call a shotgun technique, because it covers so much of the body. So again, I want to encourage you to look at your sciatic pain as beyond just where you're feeling the pain, because if we only focus on that, it's kind of like we're looking at your body in a very small, narrow view. Okay, let's get started and do this release together. What I'm going to encourage you to do is grab a bath towel that you can fold up, because I'm going to show you a variation. We're going to use the bath towel here in a little bit, but for now I'm going to set it to the side. What you're going to want is a wall or some wall space where you can put your legs up the wall. So you want to make sure you don't have furniture or pictures or anything like that where you're going to knock them down. Alternatively, if you cannot find some empty wall space at your house, use the back of a door, okay? So what you're going to do is, I recommend starting by sitting close to the wall. So I'm going to bring my butt as close to the wall as I can get, but I'm going to be kind of adjacent to it. All right. Then I'm going to come down onto my side. I'm going to push my bottom as close to the wall as I can get. And then what I'm going to do is I'm going to roll to my back, and I'm going to end up with my legs on the wall like this. Now you want your bottom as close to the wall as you can get with your knees staying straight. So I have really good flexibility in my hamstrings and my lower legs. However, you may find trying to do this that your knees are bending and you're feeling a lot of pull in the backside. If that's the case for you, I want you to move your bottom back away from the wall. So you can just kind of push here, or you can even start a little away from the wall and come down, again, roll to the back. That way you have a little space here. Again, you want to have your knees nice and straight. Okay, from here, what we're going to do is we're going to lie and imagine that this is the center of us, right at our hips. And if we have this elastic band, we're trying to lengthen up through the top of the head and out through the feet. Okay, so it's more like an intention. It's not a lot of strain on my part to get this. It's more like, what would I do if I was trying to create some space in my spine and I had a string pulling me almost like a slinky or an elastic band up through the top of my head and out through my feet. Okay, from there, you can take your towel now and you can bridge up a little bit and put this towel right underneath your pelvis, like the top of your pelvis. You don't want it at your lower back because you don't want to be here. You want to have it supporting underneath right at the top of your pelvis or the top of your butt, okay? What that's going to do is allow a little bit more opening or decompression of your lower back where those sciatic nerves come off of the spine, okay? From here, I'm just resting down on the towel, lengthening through my feet and my head. And then you can take your hands now, palms up, and go out into a T stretch with your arms. So now I'm getting this lengthening out through my hands, and I'm getting a good stretch into my shoulders, my pec muscles, okay, and across my chest. And then in this position, you can stay here and just breathe and keep that gentle kind of lifting up and out through your arms. Another alternative you can do to stretch even different parts of your pec muscles is to take your arms from the T position and slide them up into more of a Y position. So now I can feel this more down into like underneath my breast tissue and into my armpit. So depending on where you feel tight, you can play with this a little bit. I recommend sometimes doing the T stretches and sometimes doing the Y stretches. So with this technique, really, it's a great way to kind of get everything in that dural system, get the nervous system to stretch out a little bit, but not in a traditional stretching type of way. So I recommend to do this daily if you can, or most days of the week, for 5 to 10 minutes at a time. It's a really good way to kind of decompress at the end of your day, or it's also a really good way to begin your day. So you have a little bit more flexibility in the nervous tissue so that you can actually go about your day and do what you need to. And it's perfectly fine if you want to do this a couple times a day. So give it a try. And I really do hope that it helps you. So I know this video we've really covered primarily to help with sciatica, but I do want to let you know that this can help beyond just that sciatic nerve, that of course it can help with things like pelvic floor dysfunction. So if you're experiencing something like incontinence or chronic constipation or diastasis recti, that this may even help with some of those pelvic floor symptoms that you're having, as well as pelvic pain, hip pain, of course, lower back pain and sciatic pain, but also all the way up the spine, up into your upper back and your neck. So if you have some neck pain or even headaches and jaw pain, this can really help with a lot of those symptoms that you're experiencing. If you have questions about your sciatic pain and you want a customized plan to feel better so you can get out there and hike again or run or work without pain, whatever life path you need and choose, reach out to us here at the Healing Spot. Head to our website, healingspotpt.com. Let's book you in for a discovery session and get all of your questions answered and come up with that customized plan just for you. Thanks for watching this Ed Talk. I'll see you on the next one.